Hello, everyone, and thank you for joining us this evening for Prescribing Nature as Medicine with ParkRx and Sarah as our wonderful ParkRx sponsor facilitator. Thank you. My name is Carmen, and I am the program coordinator for UC. And UC is the Utah Society for Environmental Education. And our work is to promote excellence in environmental education and community engagement to connect all Utahns to their natural world. UC is the state affiliate of the North American Association for Environmental Education. There are over 53 state affiliates across Canada, the US, and Mexico that are all working to elevate the field of EE. UC works to elevate the field of EE in Utah through our annual conference, awards and recognitions of professionals across Utah that are working to elevate EE, professional development that is appropriate for K through 12 educators as well as non-formal educators, advocacy, and then continuing to strengthen and build community partnerships and programs through a variety of workshops and things like that, as well as webinars. So I will hand it over to you, Sarah, and you can take it away.
Thank you. Yes, I will quickly share my screen. One moment. Okay. Can you see my screen? Okay, great. You'd think by 2022, I would feel more confident in asking that, but I still have to. All right, so I am so happy to share a little bit about ParkRx Utah and the idea of prescribing nature as medicine. So my background is in public health. And so I work at Salt Lake County Health Department, but ParkRx Utah is kind of my baby, and I have been able to work on it for the last few years. So today I'm going to be chatting about an overview of the benefits of outdoor time. Might be a refresher for you. Hopefully it's a good reminder of some new information that you never knew. An overview of park prescriptions, an introduction to ParkRx Utah, and then some next steps. Yeah. All right, so starting off with some benefits of spending time outdoors, there's a ton out there. And when you hear about these, you think, well, why aren't I spending more time outdoors? I know I do when I'm reviewing this. So some benefits include spending time in nature decreases anxiety and negative thinking and lowers levels of depression and stress. I wanted to add this one first because in the literature, this is the one that is most founded, the most highly, I guess, what's the word, researched benefit. And so that's why it's number one in my books, but there are some other ones as well. So improves glucose levels in patients with diabetes, decreases high blood pressure in patients with hypertension. It provides opportunity to improve and retain sustainable health behaviors, which is something that I'm really passionate about. Is not only is it a great intervention, but hopefully allow people to discover their love for the outdoors, or even just walking around their neighborhood and realizing this is a really good way to be physically active. And the closer we are to green space, the less we suffer from cardiovascular, musculoskeletal, mental health, respiratory, neurological, and digestive diseases. And then I wanted to add a slide that is more focused for kids from, I guess, 0 to 18 age. So, and just as the first slide, most children don't deal with those issues like diabetes and hypertension. So for children, spending time outdoors improves motor skills, including balance and agility. Children who spend more time outside are less likely to be obese due to the space to exert energy levels. Outdoor play helps children with ADHD by giving them an outlet for activity and energy that often create issues indoors. It creates skills of greater self-awareness as it helps develop observational and reasoning skills. And then it also aids in brain development as children invent games while exploring and cultivate their organizational abilities and decision-making skills. And then a little fun fact is kind of looking at physical activity indoors versus outdoor. So there are studies that have shown that being physically active outside is better opposed to being physically active inside. So some key points is that it improves mental well-being. It allows for opportunities for more strenuous and longer workouts. You get that vitamin D intake, and then there is a lower cost to it. And then also some other positive effects it has is on vitality, energy, and decreased anger, and then it saves time and allows time for family activities, which the Get Healthy Utah, a nonprofit, has done a study on values and what the people of Utah value. And one of the number one things is family time. And so that's why I want to include that in there as well. And park prescriptions can address health equity issues. So as a refresher, health equity means everyone has a fair and just opportunity to be healthy. And so something that I love the idea of prescribing parks or just any other outdoor time is that park outings are convenient to get to. They are inviting and reliable. They are free of cost. They accommodate ability level of a patient, and they provide opportunities for regular engagement. So kind of going back to the idea of indoor versus outdoor time, most of the time, if someone's being physically active indoors, it's at a gym, and nothing wrong with being physically active indoors. Like I have a gym membership, and so I'm not going to talk badly about gyms, but for some people that actually gyms might be a barrier as to why they're not being physically active at all. And that might be because of number one, cost. A gym membership might be a meal for a family, or they might not feel comfortable at the gym. They might not know what to do, or they feel like they might be judged. And so hopefully these park outings will provide a safe place for these individuals to get outside. So in Utah, I just wanted to paint a little picture about the state, and that there is over 65% of open green space in the state of Utah, including our amazing national, state, and local parks. So we definitely have a lot of opportunities to get people outside. Such as we have our lakes, our mountains, biking, even just our local, I think we have some of the most beautiful local parks. And so just connecting people to those, I think, is a huge opportunity. And then even though we have all these opportunities, however, only 55% of adults are actually physically active, which means only 45% are they're inactive, and that's a huge number. And Utah ranks last in the country for adult mental health and for children as well. We have a serious mental health issue here in the state of Utah, which I'm sure you're aware of. And so that's another reason why we want to get people outside and moving. All right, so now that I've kind of talked about the benefits and the great things about park prescriptions, I wanted to share what exactly a park prescription actually looks like, so you had an idea of what I'm talking about. So using the ParkRx America database, who we partner with, they allow us to put any parks in the state of Utah, as well as any other unique prescriptions, as they call it. So whether that's a walking group in the neighborhood or say a swimming group that meets once a week, anything like that, we want to connect with our different partners that we have, people that are already doing amazing work and have programs to get people outside and moving. And so, but in this case, we are going to be talking about parks. So, but just know it can be expensive. So a prescriber can go to ParkRx America, become a prescriber, and we'll just use the idea of it being in a clinical setting. So someone comes into a clinic and they need to be to increase their physical activity levels. Well, so that's something that we all know. We all need to exercise, but I think we all know that we might struggle with it every once in a while, and some people more than others. And so the provider would suggest this ParkRx Utah program. So instead of saying, oh, you need to exercise, it's saying, let me give you something very specific and an opportunity to try something new, as well as maybe instead of prescribing actual medication or in supplementation of a medication. So the provider would go to ParkRx America, type in their address or even their worksite address if they want to fill this prescription while they're on their lunch break or something like that. And you can see here, they type in the address and then they can click on a certain radius that they can see what parks are in that radius. So up from a quarter of a mile to up to 10 miles. So depending on the area that they live in. So obviously in maybe Salt Lake City, they have more opportunities for parks within a quarter-mile radius, and then maybe in more rural parts, they might need to increase that to 10 miles. So then you'll see all these parks populate, and then you can click on the different parks and they will tell you the different amenities that are there. So for instance, Sugar House Park, they have a walking path and they have restrooms, things that would be important to an individual. And so once the provider provides all these different opportunities or these different parks, the patient actually gets to choose which park they want to participate there for their park prescription. So, and that allows them to have some ownership over this prescription as well. And then once they've decided on the park, it generates to this next page. So say they chose a park called Stanton Park. And so you can see it looks very much what a doctor would gather when prescribing any other kind of medication, right? So the name would be Park America, Stanton Park. And then this is where it becomes really specific instead of just saying, oh, just exercise more. It tells the person they can, well, it's a conversation between the provider and the patient, and they can decide, you know, I have a dog. I would really like to walk my dog for my prescription. So that would be the take or the activity. And then the frequency that's decided between the provider. So if someone is living a sedentary life, we don't want to make them go every day for 30 minutes. We want to slowly start integrating this prescription into their lives, because I truly believe that we just need to meet people where they're at, because it can be intimidating implementing these new health behaviors. So, but in this instance, it says the frequency will be every day. And then the duration will be for how long. So say, you know, I can exercise 10 minutes. I can go for a 10-minute walk. And so that's where they'll start. And they can obviously change that and build that up as they go. And then this prescription would be sent via text, email, or it could be printed for those who don't have a smartphone or a computer. And they can even get a reminder set up for them to be reminded that, oh, I need to fill my prescription. And so if it is sent through a text and an email, it will be sent through a link, and they will actually, on the patient side, they will receive this hyperlink, they click on it, and it'll bring them to ParkRx America, and that's how they will fill their prescription when they are at the park. And something that I do want to know is you don't have to be a doctor to give this kind of prescription. Even though my example was with the clinic, someone even in the clinic who doesn't have a license, so for instance, like a care guide or something like that, they could prescribe these parks, or a faith-based leader or a community leader. You don't have to have a medical license. And that's one of my favorite things about this park prescription process. But for the provider side of it, they will receive a copy of what this prescription was, and they can copy it, and for their own purposes, they can put it into their electronic health record. So making it a really easy process to prescribe these parks. All right, so now that brings me to ParkRx Utah. So ParkRx Utah is a multi-sector initiative whose mission is to prescribe parks and other recreational settings to prevent chronic conditions, improve physical, social, and mental health, and promote wellness by collaborating with partners and connecting all Utahns to parks and other recreational sites. All right, so to dive deeper into that, we started in 2018. Like I said, my background is in public health, and I attended a conference and I learned about this idea of park prescriptions. And I was really surprised that there wasn't an initiative like this in the state of Utah, because we obviously love our outdoors here. And so with my public health brain, I thought this would be a really great way to get people outside and moving to improve their health. And then after a while, I realized I can't do this on my own, just with my public health brain. I really needed to pull in partners from different sectors who have way more expertise in different areas that ParkRx involves. So we have partners ranging from public health, park and recreation, healthcare, research, and so on and so forth. And I think that's truly the greatest thing that we've done as a coalition, is bringing in our different partners to make this grow and be well-rounded. And then with that, as we have grown, we have developed 4 work groups to focus on park prescriptions. So we have the clinical, as you can see to my previous slides, that this is traditionally going to be in a clinical setting, but it doesn't have to be. So, but we do have a clinical work group. We do have a mental health group, because we would love to see this in mental health therapy offices and have this be prescribed to patients with anxiety and depression and other mental health disorders. And we have also a community work group focusing on different populations and community needs and our marketing and outreach. And I will be going into those a little bit later on. And we started outreach to clinics and work sites in 2019. And so we've had a lot of great success with working with work sites. And so if you are a work site, or you know someone, or you have a work site program at your office, let me know. We'd be happy to share some examples of how this can be integrated in the worksite wellness realm. And then we also have gained a following through our social media channels. So a little plug, feel free to follow us on ParkRx Utah. There's be some exciting stuff coming up with that. But we feel like with the COVID-19 pandemic, we saw there was a need that people were having this natural feeling that I need to be outside to be happy, because we were all stuck inside. And so we kind of took this opportunity to run with that. And we have been able to grow a good social media following to connect people to the outdoors. And some successes and barriers to building ParkRx Utah. I feel like it's really important to acknowledge and learn that, yes, there's some great things, but there's also things that we've had to overcome and we're still overcoming. So like I said, one of our greatest successes is our multi-sector coalition. And we're always looking for new partners, new voices, because we can't do it on our own. And we also love those connections, networking and learning about all the amazing things that are happening in the state of Utah, because we really want to promote different programs that are out there. And then we have our focused work groups. We also held a stakeholder retreat in the beginning of 2020, so right before the pandemic hit. And we were able to actually bring about 60 different partners together to kind of hear their voices on what they would like to see in a park prescription program. And so we really wanted to hear from the community to see what they think would be beneficial. And then we did have a ParkRx Day challenge last year, which I will be highlighting in a few slides, but that was a great success. And I'm excited to talk about that in a little bit. And then some barriers, despite the support from major healthcare systems, clinic buy-in has been slow, but to be fair, there has been a whole pandemic. And so, but we're really excited for 2022. There's some providers that are very excited about this. And then it takes time to develop a strong foundation for a program. And we've had to be patient with ourselves. But like I said, 2022, I feel like it's our year and we are making great strides. And then we also run on minimal funding, but we've been able to work around that, but hoping to find more funding sources in the future. All right, so like I mentioned, we have our work groups, and I'm just going to share some examples of what the work groups do. So the clinic is pretty simple. We're currently creating a clinic toolkit to make it easier for providers to integrate park prescriptions into their clinics. We know doctors are very busy, and so we want to make it as easy as possible for them. So that's currently what the clinic work group is working on. And then for mental health, like I mentioned, we are trying to get this into mental health offices. But along with that, our work group created this mental health checklist, which is so fun. And it's just a way to, even all of us people that we know how great the outdoors are, but sometimes you just need a little push to get outside and thinking of new things to do. So this mental health checklist, I love it. Just a few things that you can do is you visit a park, a trail, a green space, engage several senses, step outside. It's honestly simple as that. Just maybe sitting on your porch, get some serotonin in your body, as well as sit or walk outside, walk, hike, cycle. We really want to provide different ideas for people through this mental health checklist. So there's a really cool thing that they came up with last year. And then our community work group, it's one of our biggest work groups. And one thing that they did create last year is a community resource guide, and to provide opportunities for different populations such as veterans or children after school programs. And so that is available on our website. And now they're going to be kind of going a little bit more specific. And so they are going to focus on one community at a time so we can really make a difference. And so they are working on that, and I'm excited to see the work that they do. All right. And then, so for our marketing and outreach group, we, like I mentioned, there was a Parker X Day in 2020, and the theme for it was break from isolation, enjoy some outdoor exploration. And so we had people come up with teams that consisted of 3 to 5 individuals, each of them whom needed to be Utah residents. And then they all downloaded the free app Goose Chase and joined the ParkRx Utah's ParkRx Day Challenge. And so if you've never used Goose Chase before, it's this fun little app where you can put missions into this little app, and people as teams, they complete these missions basically. So that could be, for example, the examples are here. So like submit a photo Abbey Road style, submitting a video jumping in a puddle, really just from the smallest thing to the biggest thing, like going to a national park. And these were all on a point system. And then we gave out prizes to the teams that came in first, second, third place, as well as some random fun prizes to celebrate the amazing work that people did and the fun submissions that they turned in. So some of our goals for Parker X Day was to increase awareness of our program, as well as increase traffic to our website and social media platforms, increase positive feelings and benefits felt through being outdoors, and developing new and diverse ParkRx Utah partnerships. And so we had a lot of great success for this. So that's why we are officially, I'm not going to announce it yet. So this is also another slide about the ParkRx Day. You can see we had 152 teams. And then we had 511 participants in total throughout the state of Utah, from Logan to St. George. We had basically the whole state covered in people doing these. And then you can see to the right some fun submissions for these missions. And so you can see that Abbey Road picture, as well as fishing and hammocking and just little things. And we got a lot of really good feedback about this, and just it's fun to see people get together with their friends and their families and their kids to get outside and giving them new ideas of what to do. So now I can announce that we're having our ParkRx Day Challenge again in April, from the 14th through the 24th, and more details to come with that. So please, if you have social media, follow us on ParkRx Utah and connect with us there. We have some really good things coming up. And if you are with an organization that you would like to sponsor us, there's some information here. There's no worries at all if you don't want to, but we thought we'd put it out there because we love connecting with new people and highlighting all the amazing programs that are out there. And so, yes, follow us on social media or just visit our website, parkrxutah.org, and there should be information about it in the next month or so. All right, so I'm wrapping up here. So if you have any questions, please put them in the chat. But some next steps is, like I said, visit parkrxutah.org, connect to us there's a contact tab if you would like to learn more about how this could be integrated into your program or how we can promote your program. Or even if you know someone, a provider that should prescribe this, we'd love any kind of connection, as well as follow us on social media at ParkRx Utah, not only for the challenge, but also we try to provide new ideas about how to get outside, and we love connecting with our audience. Or you can contact me at skinnison@slco.org for more information, and I'd be happy to chat more about it. And that is my presentation.
Wonderful. Thank you so much, Sarah. I have a couple questions, of course, that I will hold in the back of my mind, but I'll give folks a second. If you want to put them in the chat, you can message me directly, or you, of course, feel free to unmute yourself with any questions as well. Alrighty, well, I will ask a couple of questions, then give people some time to think if they have any or any comments or anything else. Is there a way that you can use the Park RX website or the app without being prescribed to it or being a prescriber? I feel like it's just a great feature to be able to look through and see what's near my house in terms of like community abilities.
Yeah, I believe you can actually. I think you can type in your address. You just wouldn't be able to go through that prescription process, but I think you can still see all the parks that are available. And we also have a community calendar on our website that we encourage people to put their community events that are happening outside. So we can keep highlighting all the amazing things that are happening there. And also if anyone knows of any opportunities that should be on ParkRx America and you see that they're not there, let us know, because it really is, it's not just parks, it could be trails, it could be neighborhood walking groups, like we want to include it all.
That's awesome. Yeah, I was watching you go through all the features and I thought that those looked great to also explore on the personal side without being prescribed.
Yeah.
And then my second question was, if you see a lot of traction outside of Salt Lake, like I was wondering if you've seen the application be used, or if you have any way to know if the application is being used like across Utah and rural parks and things like that, just seeing like the full scope of the statewide rollout.
Yeah, no, that's a really good question, because obviously a prescription will look different from something in Salt Lake than Price, so that's why we don't want to just include parks. We want to include those other outdoor opportunities, or even that mental health checklist, because everyone can step outside and sit on their porch and whatnot. So we want to make sure it's not just location based, but it's more activity based, just because activities look different. Even just looking at Southern Utah, like they're not going to be taking part of a free snowshoeing activity, and so it definitely looks different, and that's something that we're still overcoming. But with our ParkRx Day, we had people in rural areas from urban areas, and luckily we try to create activities and missions that everyone would be able to do no matter what. And we also wanted to make sure that there weren't a lot of points for driving somewhere like to a national park, because not everyone can afford to take a trip to Arches National Park or even afford the price to get in. And so we want to make sure it was equitable to a point, and highlighting different areas of the state of Utah, because we want everyone to take part of it.
Awesome. Yeah, that definitely answered my question. That was wonderful. I didn't know a whole lot about ParkRx, and so it was great to get your full presentation and all the great information you provided. It looks like you have a second question from Mercedes, and she asked, can only medical providers prescribe perks?
No, so you don't have to be a doctor or even a nurse or anything like that to prescribe a park. You can be a after school teacher program, or you can be a faith-based leader. You don't have to have a medical license. They'll ask you questions, but when you become a prescriber, but nope, you don't have to be. And there's a quick video on ParkRx America on how to become a provider, but we just ask that you come talk to us first, just so we can help you through the process. But yeah, that's one of my favorite things about ParkRx America is you don't have to have a medical license to get this kind of prescription.
Fantastic, thank you. Well, I will give it a couple minutes of nice, awkward thinking silence for everyone to see if they have any questions or comments, and then we can wrap up. So everyone feel free to just sit in some silence for a little, unless you have a question, of course. It's like most people have signed off, so I will hit